anterior lateral abdominal wall dissection. So, external oblique, internal oblique, yeah. Transversus abdominis, and then anterior rectus sheath, rectus muscle, rectus abdominis muscle, and then tendinous intersection, and then posterior rectus sheath, and posterior rectus sheath, and posterior rectus sheath, and then arcuate line here. Then you can see that. Yeah.
Ano siya?
Arcuate line.
Arcuate line.
Yes. And then inguinal ligament here. Then superficial inguinal ring. And then spermatic cord, composed of the vas deferens and then testicular artery and vein, and then other parts of the abdominal wall. Yes. And then inferior epigastric artery and vein. That will anastomose at the umbilicus with the superior epigastric artery and vein. And then lastly the parietal peritoneum. Woo! And then transversalis fascia, maybe after the arcuate line. Where's that? Here. Transversalis fascia, anterior rectus sheath, rectus abdominis muscle, tapos in connection with the other one is the linea alba. And then this is the external oblique coming from below, then going up. So this is the internal oblique, which is 90 degrees orientation with the external oblique. And then this is the transversus abdominis. And then anterior rectus sheath is composed, above the arcuate line is composed of internal oblique aponeurosis and external oblique aponeurosis. And then below the this is the arcuate line. So arcuate line demarcates the division of the anterior posterior rectus sheath. So below the arcuate line, there's no posterior rectus sheath. All fascia or aponeurosis of internal transversalis transversus abdominis and external oblique goes anteriorly. And then this is the transversalis fascia with the peritoneum. And then this is the visceral peritoneum. And so here it is the inferior epigastric vessels, so artery and vein. And this is the external inguinal ring, which is triangular in shape. This is the arcing fibers of internal and transversus abdominis. This external oblique, inguinal ligament. And then this is the spermatic cord, composed of testicular artery and vein or vessels, and vas deferens, and genital branch of genitofemoral nerve. And then outside the spermatic cord is the ilioinguinal nerve.